Namaskaram. I'm Dr. Anitha, working as a senior consultant physician at Apollo Vizag. On the occasion of World Diabetic Day, I would like to share my views regarding diabetes, as everybody should be aware of this disease. We all know that diabetes is a chronic disease and it is due to high blood sugar or glucose levels in the body. This is because of either lack of insulin or less insulin that is produced in your pancreas, or your body not responding to insulin properly, that we usually see in type 2 diabetes, and lack of insulin is seen usually in type 1 diabetes. Insulin is required in our body as it causes uptake of glucose from the blood into your cells, and glucose will be utilized for metabolism and energy production. So lack of insulin or body not responding to insulin can cause high sugar levels, and prolonged high blood glucose levels can lead to diabetes and can lead to various complications. That's why early detection and diagnosis of diabetes is very important. The complications can be vascular, from heart attack to stroke, can lead to death. Not only that, so many microvascular complications like diabetic retinopathy causing decreased in vision and at times loss of vision also. Not only that, it can also lead to diabetic nephropathy, kidney diseases, sometimes leading to kidney failure and requiring dialysis. The other complications from diabetes can be neuropathy. Patients will be suffering from burning sensation of the feet, pain in feet. It can end up causing wound infections and amputation of toes, and sometimes even also losing the limb. That is the reason early diagnosis of diabetes is a must. So what are the risk factors of diabetes? Obesity, overweight, sedentary lifestyle, smoking, sometimes hereditary and genetic factors also can contribute to diabetes. So how do you diagnose? Only a few patients can have symptoms like increased urination, increased thirst, weight loss, increase in hunger, tingling and numbness of hands and feet. Most of the patients with diabetes, they do not even know that they have diabetes because they do not have symptoms. The only way to diagnose is by testing the blood sugar levels. There are three types of tests that can be done. The first is the fasting blood glucose. You should be doing an overnight fast for about 8 to 12 hours, and in the morning blood glucose levels will be tested. According to ADA guidelines, if the sugar is 126 or more, then you will be diagnosed as diabetes. The second test that can be done is HbA1c, that is the glycosylated hemoglobin. This checks your glucose level in the red blood cells, and this gives an average blood sugar for the past 2 to 3 months. If the levels are 6.5 or greater, then it is considered as diabetes. The other test that can be done is the oral glucose tolerance test. That means in a fasting state, you will be given 75 grams of glucose, that is a concentrated sugar solution. After consuming that, 1.5 hours to 2 hours after consuming, your blood glucose will be checked. If the level is 200 or greater, then again it is considered as diabetes. Once you are diagnosed with diabetes, what is the next plan? What will be the treatment plan? There are three main treatment options. The first and foremost is the dietary changes. Second is the lifestyle changes, and third only comes the medical management. The first two are very important. The dietary changes that need to be done are, you should avoid concentrated glucose containing sweets, avoid junk foods, sodas, refined sugars, maida. The diet should be consisting of fresh fruits and vegetables, more pulses, legumes and lentils, and complex carbohydrates like millets, ragi, wheat and brown rice should be taken in appropriate quantities. The second is the lifestyle changes. Lifestyle changes is, if you are overweight or obese, you need to do weight reduction, regular physical activity, not just 1 hour a day, but throughout the day. It's better to be physically active throughout the day. You should be following the exercise regimen and dietary regimen in a disciplined fashion. Only in that way you will be controlling your sugar levels. The next lifestyle changes is if you are smoking, you need to quit smoking, avoid alcohol. Third will come medical management. You need to consult a doctor who will be advising you either oral medications if your sugars are mild, or you might be requiring insulin if your sugar levels are very high. So once you have started on medications, you need to check your sugar levels frequently. Initially, probably every week or twice a week. If you are on insulin and if your sugars are not under control, it's better to have a glucometer at home and check your sugar levels at least twice or thrice a day. Fasting sugar before your meals and at bedtime, it is advisable to check. Once your sugars are under control with dietary changes, lifestyle and medications, still you need to have a frequent follow-up visits with your doctor. To have a complete physical examination, to check your blood pressure, and to have a foot examination to prevent any diabetic foot ulceration or any complications leading to that. Not only that, every 3 months it is advisable to get a glycosylated hemoglobin checked to see whether your sugars are under control. You need to check your cholesterol also every 6 months, check your blood pressure. Every 6 months, it's better to get your dental examination to see if you're having any dental caries. Kidney examination, kidney test also should be done. Your creatinine, better to be checked every 3 to 6 months, along with urine to see if you're losing any protein. Urine for microalbumin also should be checked. In that way, we can prevent diabetic nephropathy even before it starts. The next thing that you need to be checked is annually you need to have an eye exam to prevent diabetic retinopathy. It is also advisable to have a flu shot, that is the influenza vaccine and the pneumonia vaccine, as the risk of infections are high in diabetes. Thank you. Namaskar.